Do you know that one of the number one reason of deaths and serious condition in modern world is going to be high blood pressure, causing heart attack, stroke, and many other serious diseases. Unfortunately, many of you don't realize it, how high blood pressure is really serious. High blood pressure is not just a number, it is silent damage happening every single day. Millions of people live with elevated pressure for the years, without understanding what is slowly falling inside the body. Blood vessels become stiff and lose flexibility. Circulation slows down, especially in legs and brain, and the heart is forced to pump harder with every single beat. At first you may feel nothing, no pain, no clear warning sign. Medication may lower the number of the monitor, but internal damage often continues quietly, and the vessels' walls remain stressed. Inflammation stays active inside the arteries, and the heart ages faster than it should. And this is how serious complications develop long before a real diagnosis is made. And this is in today's video I'm going to give you information what exactly help my patients when we make special protocols for the people that have heart problems. We're going to give you exactly what are vitamins that really need to use each day, and how exactly and what exactly is the main problem that you have high blood pressure that causing you and put you in a higher risk of most serious diseases of modern world. The real mechanism most people never heard. Blood pressure is not only about salt or stress, it is strongly connected to the nerve control, vessel tone, and the cellular energy. Your nervous system constantly tells blood vessels when to relax and when to tighten. That control depends on micronutrients, and when key vitamins are missing, blood vessels lose flexibility and elasticity, and the inner lining becomes more sensitive to the pressure. The heart then becomes compensate. It pumps harder more than the same amount of the blood. And over time, this raises pressure even more. And after age of 45, the absorption of nutrients declines. Chronic stress increases vitamin loss, and many medications further depletes essential vitamins. This is why blood pressure are often rise slowly, and even with people who believe they live a reasonably healthy life. Can you please comment below the video when the last time your doctor checks your or did check your vitamins, minerals level in your body if you have high blood pressure? Or did you only get medication 1, 2, 5, 4, 5, 8 pills each day, and this is perfect for your health, right? Please comment below, did you ever check your minerals and vitamins level if you have high blood pressure? Now let's talk about vitamins that are best for those problems. The most important vitamins is going to be vitamin B complex, especially vitamin B1 and B6. Vitamin B1 or thiamine is essential for the heart energy metabolism, and your heart is a muscle that never rests. When B1 is low, the heart pumps less efficiently, circulation weakens, and fluid retention appears, and pressure inside vessels increases. Long-term vitamin B1 deficiency can directly worsen hypertension, and this deficiency is very common in people using diuretics, under chronic stress, and with high sugar intake. Especially for you people, especially for you women after 50 years and older, you already have high blood pressure, right? Probably you will never watch this video if you don't have high blood pressure, but unfortunately you have. You don't have any kind of direction what are the nutrition that you need to eat each day, what are good diet, what are the food that is perfect for you, what food you must avoid. Just only simple explanation, avoid salt and just to take medication. Everything is going to be perfect. Recommended daily dose is 50 to 100 milligrams daily, often in the higher chronic condition. My second recommendation is going to be vitamin B6. Vitamin B6 regulates nerve signaling that control blood vessels. It directly affects how vessels relax and contract. And without enough B6, vascular tension increases. Inflammation inside walls grows and pressure regulation becomes unstable. B6 is also crucial for magnesium function, which is another key element in blood pressure control. The recommended daily dose is 25 to 50 milligrams daily. In the short, this means, my dear viewers, if you have high blood pressure, if you want correctly, in the safe and natural way on the long term, you must first check your blood test, see if any of these are missing nutrients in your blood tests, and you can take vitamin B6, especially vitamin B complex in the food that is perfect with a high amount of vitamin B complex, or take good 100% organic supplements that have vitamin B complex. And this is step number one. Step number two is going to be, of course, you must correct it, vitamin C. Vitamin C is essential for the structure of the blood vessel, and it supports collagen inside the vessel's walls. When vitamin C is low, vessels become fragile, elasticity is lost, and pressure rises as compensation. Vitamin C is also reduce oxidative stress, which is one of the main drivers of vascular aging. Of course, you have B vitamins deficiency, and you have chronic deficiency in vitamin C. And third, also unbelievably important vitamin for prevention of high blood pressure is going to be vitamin E. Vitamin E protects blood cells and improves flow. It supports proper movement of blood through small vessels. Low vitamin E levels are linked to thicker blood, slower circulation, and increased vascular resistance. This directly contributes to rising blood pressure. And recommended daily dose is 100 to 200 international units daily. Please remember those lists. In most cases, you will need those vitamins if you have high blood pressure. Now I'm going to give you a couple of information why modern medicines never cure high blood pressure, and why high blood pressure is one of the probably number one or number two killer in the modern world. But we don't even realize it, because the high blood pressure can continue for the years and years and years, and when we take medications, we are thinking that we are perfectly safe. But this is wrong. Why modern medicine cannot fix the cause? Conventional treatment usually focuses on medication, and the most common options include diuretics, ACE inhibitors, and beta blockers. And those drugs are designed to control blood pressure numbers, and in many cases they do exactly that. But here is the deeper problem. They do not restore nutrient balance inside the body. They do not rebuild the elasticity of blood vessels' walls, and they do not improve nerve regulation that controls vascular tone. Over time, many of those medications actually increases vitamin and mineral depletion, especially B vitamins, magnesium, and potassium. And as deficiency deepens, the body becomes less capable of regulating pressure naturally. So while the number may look better on paper, the biological system maintain healthy circulation continues to weaken. And this is why after months and years, higher doses or additional drugs are often required. Did you ever, my dear viewers, receive your medications for the high blood pressure, and maybe after 1 week, 2 weeks, 1 month, maybe 3, 5, 6 months, you really don't need any of those medications, or maybe the truth is completely different. Maybe after 6 months, or maybe after year using everyday chemical medications for high blood pressure, you need higher dose, other types of medication, and you are never healthy, and you always have high blood pressure. If high blood pressure can control only with medication and we avoid everything else, please look around, my dear viewers. I see it for the couple of decades. Of course, everyone chooses the easiest way. This is taking the pill, lower high blood pressure. When the high blood pressure goes up, we take another medication, another medication. Because healthy, first of all, you don't know what healthy lifestyle is. You don't know exactly what you need to do. And this is always the easiest way, but it's the wrong way. I'm going to give you two information at the end of the video. First one, my dear viewers, if you have high blood pressure or you have any kind of heart problems, and if you want to find out how we help our patients, especially in those critical chronic stages of their diseases, call up my office. If you're watching me right now for any part of the world, we're working with the patient all around the world daily. Call us. We're going to give you solution with MarioLab protocols with nutrition and natural remedies. This is exactly what you need need about when you have chronic high blood pressure or any kind of heart problem. Second information is going to be with those people that you're watching me right now, and you want to know exactly what supplements that we use in our patient, especially those minerals and vitamins that are 100% organic and help a lot of our patients. Call our office and we will give you exactly information what supplements we use in our office, especially minerals and vitamins, and you can buy them and help yourself. My private medical office works with the patient all around the world for the last 26 years. You can seek my private phone consultations, or you can come directly to my MarioLab center in Zagreb, Croatia. All you need to do is just call my office on the phone number +385 9891 79200. Call my office, seek my private consultations, or you can come directly to my office. I'll be making sure that you'll be healthy again in the safe and the natural way.